Ciao.
Bayonet is a citizen-driven initiative aimed at saving lives from malaria. I'm a registered nurse, and I traveled to Uganda in 2004, and I had no idea about the devastation that malaria causes on families and indeed the entire nation of Uganda. So early on in my trip, I was faced head-on with this killer disease in a young boy named David. He was 8 years old, and as a registered nurse, I had never, ever in my entire career felt so helpless as I did in the face of a treatable and preventable disease. So as a result of that trip, as a result of all the moms and the children that I met who had been affected by malaria, I came back home and I met with friends and family and shared my story with them and my need to do something, because we have so much here in Canada. And in a subsequent trip, the plans to develop Bayonet came to be, and we launched that year. Malaria is a leading killer of children, taking a child's life, within 24 to 48 hours. And pregnant women are also most vulnerable. We just don't give the bed nets. There's a process of education, engagement, and empowerment. And it's largely women that emerged as the health leaders in almost every community that we worked in. So for me, what really stands out is the strength of the women. And it's the women who nurture the children. It's the women who keep that household together. One particular instance for me was in my first trip. Her name was Veronique, and she was a mom living in such abject poverty, but she sang to me. And she, like so many other women, got down on her knees to me. And I remember thinking, had she lived in Canada, she could have been anything she wanted to be. And she didn't have to kneel. Because for me to give of my time and to be there and to do what we do here in Canada, it's a privilege. Because I learned so much more than I could ever impart there. Through our community partners, it just propelled itself, and one door led to another door, and we were very fortunate one year to have Heather Haynes join us with her son Whitney on a volunteer experience. And when she witnessed the devastation, but the beautiful work that we do and the joy that it brings, it inspired her to create a collection known as Worlds Collide. So it's good, caring people like that that carry the goodness of Bayonet across the nation.
Well, I'm honored enough to be sitting on the board, and that was something that came out of my trip to Uganda with Bayonet several years ago. And it all sort of came about because my partner on a couple of children's books, Heather Haynes, had asked me to come and help Bayonet. They were through an event that they were trying to run, and event planning was one of my fortes. So I went in and met everybody associated with Bayonet, became familiar with the cause, and then really just never left.
Joanne was with us that same trip in 2008. Joanne brought her daughter Emma on the volunteer experience, and Joanne's involvement was because of Heather's involvement, and that's how it goes. And Joanne was so affected by what she saw and the experience that she had that she joined our board of directors. She's a champion and an ambassador for the work that we do, and she has a very busy life, and so we're so grateful for the time and the energy that she adds to the work that we do as well, and she is a powerful force.
As a parent, I've always felt a responsibility to leave that sort of legacy to my kids, that it's not just about us, that we need to pay attention to what's going on in our community and our country and our world. And I think just every little thing we do with things like Bayonet just brings us that much closer to fulfilling it. I was so thrilled when Deb told us that we were going to be partnering with Bead for Life. I think most especially because when we were in Uganda, we had the privilege of going into a women's center for women and children with AIDS. And it was within a village that had been netted, and we were going there to evaluate, a year later, to evaluate the success of the bed nets within this village. And at this clinic, they were making these beads, and we actually, and when I say they, the women, a lot of whom had AIDS, were in there using this to make money, and we saw them licking the paper and doing it all, and they had their own little shop there. So we, of course, bought all sorts of beads and brought lots home to give to people as souvenirs, but fell in love with the beads, and then, of course, the women who were making them, and they had done this great big play showing Bayonet how successful the bed nets were and what having the bed nets meant to them. And so that was a really touching moment of our whole trip for me, and so to have us now be, to see these beads everywhere it just means it's working. Something, what everyone's doing is working. To see these beads on this side of the ocean and to have the beads paying forward and forward is wonderful.
With the proceeds from the sale of the beads, we purchase bed nets, medicines, provide health interventions to make families stronger and healthy, and indeed communities and the entire health system in Uganda. And so not only are we combating malaria that way, but we are directly helping to alleviate poverty by creating sustainable employment. It is such a remarkable partnership. It's a very simple one, again, one that I think all people can relate to. We provide employment, we empower women, their families, they're able to dig themselves, lift themselves out of poverty, and we then take these beautiful beads and the gift just keeps on giving.
The problem is so real and the solution is so easy that all of us who have witnessed what we saw in Uganda, especially up close, you want to spread the word around, and it becomes a bit of a responsibility, I think, once you've been there to let people know how easy it is to solve this horrific problem that malaria is.
It's such an easy solution, and it's so simple. And not only were we fundraising and providing the bed nets and the medicines, but we were also leaving behind an empowered community or empowered citizens in Uganda. And all of us, I think, have an obligation to do whatever we can. And every part, small, big, medium size, makes a difference.